Good day, everyone. As the time you're applying from wherever we are watching from, I am Dr. Osimiloluwa Albert, and we are having a topic of discussion concerning our health today, which is wellness check. Wellness check is a routine physical examination and tests that are carried out by your primary care provider to check your overall health. And this primary care provider may be a doctor, a nurse practitioner, or a physician assistant. And the examination is also known as medical check. People have different reasons for seeing a doctor, but some people just go for treatment. But this one that we're talking about is, and the main goal of it is for prevention, and health promotion is to reduce the burden suffering of the major preventable diseases. So when we talk of a wellness check, you do not need to be sick before you go for your check, and these are the routine medical check. The requirements are different for annual medical physicals, prescription drug follow-ups, prenatal childhood checkup, and well woman examination. Some people expect to have a yearly checkup, and others feel that a checkup once every 2 years or 3 is sufficient. There are 3 levels of preventive care. All these 3 levels are to prevent, and they are important components when we talk of wellness check. There is the primary prevention, which is the intervention that is given before the sickness arises. And example of this is to take immunization for some diseases. Then secondary prevention is to identify the sickness early, so that before it becomes troublesome. And example of this is when we do pap smear for cervical cancer. Tertiary prevention is that one that takes care, is like to rehabilitate when the problem is already there. So preventive intervention that your doctors may use you to check up are screening tests. Screening tests are useful in the early detection of disease. Some examples include the physical examination, blood pressure reading, pap tests, and laboratory tests. Immunization, as we have said before, which is for primary, you can take some vaccine. Even for the cervical cancer, we have vaccine that are used. Medical prescription can also be done. Then we have counseling for health promotion. Now when we talk of the things that are done for the wellness check, there are different things that are done at different age groups. When we talk of age groups between 19 and 39, you have screening, which is a thorough individual risk assessment. The height and weight can be measured, blood pressure, clinical breast examination, blood cholesterol, pap smear, and in high risk group, sexually transmitted diseases. Counseling and education about diet, about their diets, folic acid supplementation, which is good for childbearing age people. Then we have tobacco cessation, drinking and driving safety, then contraceptives. Immunization, there are different diseases that immunization can be given to. Then preventive services for ages between 40 and 64. There is still screening, which is also, as was earlier mentioned, height and weight, clinical breast examinations. Then there's additional one, which is mammography. This one is optional for 40 to 49, but from 50 to 75 years, it has to be done every year. Then colon carcinoma screening. Counseling also is part of the things that are done for this age group, and their immunization that they can take. They can take some for tetanus, for influenza, and the preventive medication for those people that have heart diseases, like taking aspirin, which is blood thinning drug. Then preventive services for ages 65 and above. They are the one that is additional to them is the fact that they need to do their vision tests. and hearing test. Vision test as from 74 years, and hearing test as from age 74. Now, there are some postmenopausal hormonal replacement therapy that may be needed, and also physical activity that they should be encouraged to be doing. We should note that in some places like in Nigeria, all these checks is like out of pocket payments, and people are the ones that will on their own decide to do it, whereas in other developed countries there is a preventive service task force who are responsible even to remind them of when they are due for their normal screening. So when we talk of routine test, at least the minimum thing that one should do, you look at your weight and height and body mass index. With this will enable one to know if the weight he or she is having is healthy. Then blood pressure check is very important, because until you check, you will not know if there is hypertension or not. Then clinical breast examination, hemoglobin, which is the blood level that can show if one has anemia or not, HIV screening, hepatitis B, hepatitis C, all these serological screening are important, because if you don't test them, you will not know. Screening for the kidneys, urine creatinine, for urine, for bladder, blood sugar for diabetics, then screening for cervical cancer and prostate cancer. All these ones are important, and by the time one is able to get this one done routinely, you'll be able to pick the disease even at when it is about starting, or it has even started, but where at the point where it can be cured. Now, because of the fact that in some places where it's the individual that will have the money they need to get the money for this test, they are supposed to have been planning for it, and there should be a way that they can be reminded as to when they are due for their screening. When there is a primary prevention, then you will realize that the disease will, at the end of the day, will not come up. But for secondary prevention, one is able to get it, some of them at pre-cancerous stages where it can be cured. Whereas when it is now the tertiary prevention, that place, then there is you now need to rehabilitate the person that is already having it, so that they can live the rest of their life peacefully. Health is wealth, knowledge is power. Prevention is better and cheaper than cure. I pray that God will help us and give us the grace to put to practice what we learn.